No, but I was, yeah. Actually moved that Hello, everybody. We're about to get started with our live stream. Will we all please take our seats so we can get started? Thank you. Thank you, everybody. We're about to get started. Thank you so much. Could everybody please take their seats? Just a second. Thank you. Thank you. Hello, my name is Dr. Michelle Reed, and I'm the Vice President and Chief Operating Officer here at CNS Healthcare. And we're glad to thank you to participate today in our live streaming event, which is also a town hall meeting. This event today is sponsored by the Michigan Behavioral Health and Wellness Collaborative. And I really want to invite all of you all community members coming and welcoming us to participate in this activity today. The collaborative was established in 2017 as a platform for critical conversations and collaboration across our behavioral health community in Wayne County. We're a network of providers in Wayne, Oakland, and Macomb counties that are committed to strengthening the voice of community mental health organizations and ensuring that every individual has access to comprehensive, integrative care. Today's conversation, it is a conversation, is an opportunity to build on that spirit of collaboration, to explore how all of our agencies can work together to support the state of Wayne County in advancing their public health priorities, and how we can better align our efforts to protect and strengthen our community. We're honored to welcome two extraordinary public health leaders who embody that mission. But first, a little bit about CNS Healthcare. We are a certified community behavioral health clinic operating in Wayne, Oakland, and Macomb counties, providing comprehensive mental health and substance abuse services. We have been involved at the forefront of the vaccine movement here, and it started with us in about 2014 when we had several individuals die as a result of communicable diseases, particularly pneumonia. Before that, we had not had a comprehensive vaccination program and took the opportunity to partner with our in-house pharmacy to start giving vaccines. And since then, we've given thousands of vaccines at 2 clinical sites for measles, mumps, rubella, to the COVID vaccines, to flu and pneumonia. So that's been hepatitis. It's been very exciting for us. You know, we partnered with the Oakland Community Health Network. We're glad their Chief Medical Officer, Dr. Posios, is here to partner with us today to really change our strategy on how we looked at the vaccination process. We began to look more at people who we serve who are at high risk for developing, and I think Dr. Posios has participated with Dr. Bagdasarian on the statewide Vaccine Champions Work Group, something that we really valued and took to heart here in Southeast Michigan, how we get the word out and use trusted voices in order to have a conversation about that. Also, as a certified community behavioral health clinic, we're required to provide medication-assisted treatment from the Substance Abuse and Mental Health Services Administration. And so we've been providing medication-assisted treatment for alcohol, tobacco, and opioid use disorders. We massively, over the last 5 years, have expanded our naloxone program. We've expanded our access to medication-assisted treatment with the Suboxone and Sublocade. So this has been a very important part of the efforts we have. You know, we've looked internally and worked with a couple of federal grants around zero overdose, but also zero suicide. So these are two things near and dear to our heart. When you talk about the opioid epidemic, we talk about the vaccination issues, communicable diseases. These are very important to us because it dovetails right into suicide and it dovetails right into our medication-assisted treatment. So we're glad to have you all here. Our format today is that of live streaming. We found that how people connect with us at CNS Healthcare is on multiple levels, from bright signs in our lobbies with information to town halls like this, but also on social media. And I likened it to how we go to church. You might go to church and see 100 people, and look online and there are about 50, but by the end of the week, 1,000 people have seen the service. So again, we have various audiences who would like to learn about this information and look at it on their own time. So we're excited to be here with you today. And now to introduce our speakers. Today, we have Dr. Bagdasarian, who's joining us as Michigan's Chief Medical Executive. She has been working with the Michigan Department of Health and Human Services and is board certified in family medicine and in internal medicine, so that's another good thing. And also, we are excited about her passion to talk with us about several different things. So one, she's going to talk with us about vaccinations in the great state of Michigan, and also she's going to talk with us about the opioid epidemic and impact on the great state of Michigan. Also, she's going to talk with us a little bit about gun violence, which is an exciting thing to talk about today. And also, Dr. Avani Sheth, she is the Chief Medical Officer of the Wayne County Department of Human Services. It has a new name that she'll remind us about. So we're excited about her participation in that. And she also is going to talk specifically about the Wayne County reaction to such. Our last session, we gained valuable information about how we interact with both the state and Wayne County, and I learned about a lot of new resources. We will attach to our web presence additional information in forms of slides and QR codes. But this is really intended to be more of an informal conversation talking about these three topics: gun violence, the use of medication-assisted treatment or opioids, and what has been the overall impact of vaccines in the state of Michigan. And we're counting on all of you all to assist us in amplifying these messages. Thank you. Dr. Bagdasarian, please.
Hi, good morning, everyone.
Good morning.
So pleased to be here with you. Is it okay if who am I asking? Is it okay if I sit?
Yeah, go ahead.
Okay, thank you. So I am really excited to be able to share with you just a little bit about what's happening with public health in the state of Michigan. And then Dr. Sheth is going to give you a look at Wayne County and what's happening more directly here. I wanted to start with talking about vaccines because vaccines have really been in the news recently. There's a lot of confusion coming from the federal government. There has been a lot of conflicting information coming from different parts of the federal government. And so I want to just clear up a little bit of that confusion. Here in the state of Michigan, we are making sure that we're following the science and the data on vaccines, and that we're not giving any biased information to you all. And so what we're doing here in Michigan is we're aligning with the big national medical organizations. So the American Academy of Pediatrics and the American Academy of Family Practice are two of the big ones. And we're making sure that we're following these organizations that have looked at all the science and made sure that we are giving you the best information to make decisions for yourself. So I'll tell you a little bit about what's been happening with vaccines. Since COVID, and since people started talking about some of these issues, and since they became political, we've seen a decline in our vaccination rates. And we've seen a decline for flu vaccine, for COVID vaccine, and for all those routine vaccines that kids have been getting for decades, that many of us got as kids. Things like the measles, mumps, rubella vaccine, the polio vaccine. We're starting to see declines in those rates. And as a result, we're also seeing an increase in things like cases of measles. We've had several measles outbreaks here in the state already. You might have heard about what was happening in Texas, where they had a massive measles outbreak. And in Canada, they have had about 2,000 cases of measles just in the last year alone, and recently lost their measles elimination status. So we're in this whole new world of what's happening with vaccine rates going down and some of these diseases going up. But I want to let you know that we've got really clear guidance on our website. So talking about COVID, who should get a COVID vaccine? Anyone who is over the age of 6 months and doesn't have an allergy or a reason not to get the vaccine, we recommend you get it. And it is available still in places like pharmacies and local health departments and local clinics. And insurance companies are still covering COVID vaccine the way they did before. So there's no big changes. We're still recommending COVID vaccine. Flu vaccine is essentially the same thing. And we continue to recommend all of those childhood vaccinations for little ones like measles and mumps and all of those. So there are no major changes with that guidance here in the state of Michigan. Does anyone have any questions about vaccines? Yeah,
I
go
don't
ahead.
know whether you need one.
So, sorry, we'll come to you next. So how do you know if you need a vaccine? So flu and COVID, it's every year, right? If you haven't had your flu and COVID vaccine this winter, it's time to get one.
I have them already.
You had them already, that's fantastic.
What you have to tell me? You have to say y'all this that you need.
The other shots you need? So the best way to figure out if there are other shots you need is to talk to your healthcare provider. So for example, there are some shots that we recommend after the age of 50. There are some shots we recommend as you get older. So the pneumonia shot, the shot for shingles. So it's a good idea to talk to your healthcare provider to see what you need based on your health conditions.
Does the health department still have a list of what
Yes.
they gave you?
The health department has a list, so
So you
we've
can
got,
ask them what you need.
exactly, you can ask the health department what you are due for, or you can ask your local pharmacy.
Thank you.
Those are good places to go. Yes,
Yeah, they had a list of all the shots I needed, and I got all my vaccines and everything. That's all I want to say.
that's fantastic. Thank you for doing that.
Behavioral services.
Thank
Good on that at the pharmacy. I had my COVID, like more COVID shots, just in case. I don't have COVID, but I got the shot just
Yep.
in case.
And-
Something positive.
And what that means for you is getting the COVID vaccine and the flu vaccine means that if you get those diseases, chances are you won't end up in the hospital or in the ICU. So great job getting those shots.
Okay, I'm kind of afraid to get the shingle shot. I'm over 50, but I'm scared that I might get a breakout if I get it. So, but they recommend you get it, I guess, after age 50.
Yeah, so the shingles vaccine is a really interesting one because most of us in this room, we already have the virus. We already have it, and what it's doing is it's sitting in our nerves, and it's waiting for a time when we're sick or stressed out, or we've got a ton of things coming up, and then it flares up. So we already actually have this virus inside us. And what the vaccine is doing is it's teaching our immune system what to be on the lookout for. Because as you get older, after the age of 50, your immune system isn't quite as fit and young as it used to be. And shingles, I've taken care of a lot of people with shingles. It's extremely painful. When you have the rash, it's painful, and it can be painful for several months after the rash. So that is one that I'm going to make sure I get the minute I turn 50 because I don't want to end up with shingles. So chances are you already have that virus, and the vaccine is just teaching your body how to handle it.
And if you're diabetic, is it any contraindications of not getting it, or is it okay to still get it?
It is a great idea to still get it because if you have diabetes, sometimes your immune system can be not, again, quite as strong. So yes, it is a great idea to get the shingles vaccine if you have diabetes.
Last one, is it yearly? Is it a yearly
Nope.
shot? I'm sorry.
It is not a yearly shot.
It's just a one and
It's a
done?
one and done.
Thank you. Okay, sorry, y'all.
No, it's fine, it's great.
Yes, 2 shots. But it's not an ongoing is what I mean. Yeah.
Is COVID a one-time deal? I mean, if you get all the shots, you have to keep on going every year or every 2 years?
Yeah. COVID isn't every year. And the reason for that is there's 2 big reasons. Number one, the virus is changing. So every year the virus mutates a little bit, and the current COVID vaccine is protecting you against this year's COVID. So that's reason number one. Reason number 2 is the vaccine is most effective for about 4 months. So after 4 months, your immune system sort of forgets again. You got to give it that reminder. So yes, it is a good idea to get the COVID and flu vaccines every year.
All right, thank you.
Oh, sorry. Go ahead.
I'm saying, I've been in the hospital waiting for to get the pneumonia shot. How do I get the pneumonia shot?
So your local pharmacy, your local health department, or if you've got a primary care doctor that you see, your local clinic. Any of those places should be able to either give you the shot right there. Can you say that last part again?
I already got the flu shot.
Great job. And next, I would talk to one of those folks about getting your pneumonia shot too.
Because when I was in the hospital because of my stroke, I saw the people go get the pneumonia shot and they got the
Yeah, a lot of hospitals do give pneumonia vaccine on your way out the door, but sometimes with timing and all that, it doesn't happen. Yeah, I would go to your local pharmacy or your local health department and see if you can get that.
Okay.
Any other, are we doing okay on time? Okay, any other questions about vaccines? Amazing, thank you for those questions. The next thing I wanted to talk about is gun violence. And it's a really important thing for us to talk about because it is the #1 killer of our young people. It is the #1 cause of death for kids and teenagers in the United States and in our country, and in Michigan. And so we need to start thinking about this as a public health issue. And I just want to raise your awareness about 4 laws that were passed in 2024. So #1, we've got a universal background check law. That's sort of self-explanatory. If you're buying a gun, everyone needs a background check now. But also along with those, we've got some laws about extreme risk protection orders, or some people call them red flag laws. So what this means is if you know someone, or if you yourself are having, for example, a mental health crisis, you can just temporarily remove those guns so that no one gets hurt. And so we are putting out information on how you can use those types of processes. So if, for example, you have a family member who's having a mental health crisis who has a gun, how you can file to just temporarily take those weapons away. The other law that was passed was on secure storage. And if you have kids in the home or someone who is having a mental health crisis, secure storage can really save lives. And so I just want to raise this for everyone because a lot of folks don't really know what secure storage is. They think that storing your gun on the top shelf of a closet, that's secure, or storing it, in a nightstand, that's secure storage. But what we really mean by secure storage is a gun has to be stored unloaded with a gun lock secured somehow. And that is very important if you've got kids in the house. And there are a lot of programs that are giving away free gun locks for folks who are interested. Sorry, did you have a question?
Yeah, sometimes we have people in the house that could have you take your gun and they don't attack you. Anyway, that's not mental.
Yeah. So there are all kinds of reasons for gun violence.
That's why I don't put the gun up in the safe.
I think having a gun in a safe is a really good idea. Locking it up in a safe or using a gun lock, those are both acceptable ways
I
to.
have some guns, I put them in the safe. I do have mental problems, but I put mine in the safe to make sure it's safe for me. I don't put other people.
That is wonderful. Thank you for doing that. And again, you're protecting yourself and other people. If you have kids who come over and visit, if family comes over and visits, it's safer for everyone. With a lot of kids who end up hurting themselves unintentionally, a lot of times those kids think that the gun is a toy or they think the gun is unloaded. And that's how these tragedies happen. So thank you for doing that.
A little gun lock for a shotgun.
So the gun locks that we are giving away free from the state are more for handguns. but there are all kinds of different locks that are available.
The longer ones that we have.
Yeah, and so we might not be giving them away free from the state, but there are lots of different types of gun locks out there that are available for whatever type of weapon you have.
Thank you.
Thank you. Okay, the last topic I wanted to talk about was the opioid crisis here in Michigan. And we've had a lot of success in Michigan in bringing down our overdose rate. So we brought our overdose rate down by over a third just in a 1-year span. We're the number 5 state in the country for reducing those overdose deaths. But we've got to make sure that the tools are reaching all of our communities. One of the biggest tools we have is something called naloxone. The way that these opioids work is they actually stop people from breathing. They bind to receptors in the brain, and people actually stop breathing, and that is how a lot of these deaths happen. Naloxone binds to those same receptors, and they can get people breathing again. So it's a very valuable medication to have on hand, and we want to get naloxone into every community, into everyone's hands, even if you're not using opioids, if you're not using pills yourself, someone in your life might be. I talk to a lot of parents about having naloxone in the house because you never know what your teenagers are getting into. It's a medication that's really stable in cold temperatures and hot temperatures. So I keep naloxone in the glove compartment of my car just in case. You never know when you might need it. And naloxone has been one of the biggest success stories. So we're going to continue to get it out there. But we have to make sure we're really reaching everyone. And one of the things, and Dr. Sheth, I'm sure we'll talk about this a little bit, one of the things that we've seen in our trends across the state is there have been a lot of emergency department visits for young women and teenage girls. And the other place where we've seen a lot of overdose deaths is actually in older Black men. So Black men over the age of 55 also are in a really high risk age group. And so part of the reason we think for this could be that folks don't know that they're at risk. They don't believe that they're taking something that has fentanyl or opioids in it. And so we really recommend, if you are using any kind of pill or powder, understanding that that substance could be contaminated with opioids or fentanyl, and keeping naloxone with you. So those are really the 3 things that I wanted to talk about. Does anyone else have questions for me?
One question, one of the community organizations we were working with to get naloxone lost some federal funding and they're not supplying it in the rate they were. Could you tell us what are the state resources to restock our naloxone kits?
So I'll give you some QR codes that you can post as well, but we actually have a state naloxone portal, and you can go on this portal, and either if you're an individual, you can have naloxone mailed directly to your home.
My pharmacy gives it to me.
Who gives it to you?
My pharmacy.
Amazing. That's another way to get it. So you can get it through your pharmacy, you can have it mailed to your home, and organizations can also use our naloxone portal to request a restock.
So does everybody here know that you can get it from your local, where you're going for services as well? All you need to do is tell your therapist or your case manager.
And what's the website for that? Do you have the website for it?
I have a QR code for the website. I think the website itself is a little bit longer, so I will share the QR code. If folks have a phone with them, the QR code is down here, and you can just take a picture of this QR code and it'll take you to the website. But we'll make sure that we get that out to everyone. And again, naloxone really saves lives. We've given out just in the last few years 1.3 million free naloxone kits, and we have been told that at least 30,000 of them have been used. And again, this is a tool that starts people's breathing again. So when opioids stop your breathing centers of your brain, this medication can restart breathing again for people. And I'm sure you're all familiar with how it works. I think Dr. Sheth will talk about that. So why don't I hand over to you? Thank you.
Thank you so much, Dr. Bagdasarian. I'm thrilled to be here with all of you. I'm Dr. Sheth. I'm the Chief Medical Officer at Wayne County Health Department. So Wayne County Health Department covers everything else in Wayne County outside of the city of Detroit. And then Detroit has its own health department, Detroit Health Department, which I'm sure everyone is familiar with.
Down on Mac,
Yes, correct.
Mac and Woodward. That's the one I go to.
Yes, so I'm sure it's great. You know, it's a great access point. We both provide similar services to the community, and we have similar goals, right? We want to improve community health for everyone in our county. Dr. Bagdasarian talked about some issues that we're facing as a community. I'm going to talk a little bit more about those and really how we are impacted in Wayne County specifically. And so in Wayne County, you all may be aware of this, but we are experiencing one of the most significant overdose crises in Michigan and even around the country. So in Wayne County, just to give you all an idea, we lost nearly 1,000 lives in 2023 from overdose deaths. And these are all somebody's loved ones, right? Sister, brother, son, daughter, friend. I think that almost all of us have been touched by this crisis, either directly or not so much far removed from it, right? And so Dr. Bagdasarian talked about some of the efforts underway to combat this. I want to also mention and highlight some of the stats she shared for Wayne County. We know that this overdose crisis impacts every community in Wayne County. There's not one community that's not touched by this crisis, but we know that certain communities are impacted more. And so in Wayne County, we see our Black community and residents have 2 times the overdose death rate compared to our white residents. And we see that rate is going up instead of down, which is where it should be going. And then our older population, over 55, are experiencing a higher risk for overdose deaths than the other population. We also know that many of these individuals that suffer from substance use issues also suffer from mental health conditions, right? And so they have multiple different barriers to care and root causes of why they may be using a substance. We know that we have, though this is, there's a lot of suffering in the community, we actually have an antidote, right, called Narcan or naloxone that will revive people from an overdose and save them. And so what we're really trying to do is make sure Narcan is in everyone's household, everyone's first aid kit. Everyone can easily reach for it, not only if they are themselves suffering from substance use issues, but if their neighbor or their friend or somebody down the street, right? To have it always available and easily accessible and within reach. And so we're thinking about it as, you know, hopefully you don't have to reach for it ever, right? But if you do, it's right there. And so what we have available in Wayne County are these things called Well Wayne stations. You may have seen them around, they're around Detroit and all around Wayne County. They're this blue color. Some of them are vending machines, and some of them are these old newsstands, you know, that you can just open up. And they carry Narcan, free Narcan to anyone who needs it. No questions asked. You just go up and you get one. And they also carry drug testing strips, fentanyl test strips and xylem seeds test strips. And so I'll talk a little bit more about that as well. So we know that with our overdoses, the reason why it's a crisis is that the drug supply has become a lot more dangerous than what it was decades ago. And so fentanyl, you all may have heard fentanyl, is causing around 4 out of the 5 deaths we see in Wayne County. And so what we've seen with fentanyl is that it is a very strong opioid. It's about 50 to 100 times stronger than heroin or morphine. And fentanyl has entered the drug supply to the point where it's in lots of different substances. So it's in pills and powders that Dr. B mentioned. It's in things like cocaine and methamphetamine, and all sorts of other benzos and Xanax. Any pill or powder that is not prescribed by a doctor, we're oftentimes finding fentanyl. And so there could be individuals who potentially, use once, right? Are hanging out with friends and using once, or maybe used to using something else, right? And all of a sudden fentanyl is in that supply, and there increases their risk for overdose. So that is one reason why we are trying to put out Narcan everywhere, right? Because it's not just individuals who are suffering from substance use disorder at risk, but the larger community is at risk as well. There's also lots of different things in drugs these days, right? There's almost more than half of the supply of drugs right now contains more than one thing. And most people aren't aware of it, right? They're thinking they're using something or purchasing something, and it has a whole slew of substances in there. What we've also seen in addition to fentanyl are substances called xylazine, which is it's also called tranq, is another common name for it. And it's a animal tranquilizer, right? And I don't think anybody is actually going out and seeking this drug, but it's entered into other drugs that they may be using. It is a sedative, and so it really increases the risk of slowing the breathing, slowing the heart rate, slowing the blood pressure, and increasing overdoses. It also causes pretty severe wounds and sores that can spread really rapidly, and so it really puts people at risk for that as well. There's also something called medetomidine. These are all complicated names that I have challenges pronouncing myself. But it's similar to xylazine, right? It's an animal tranquilizer as well, but it's 100 to 200 times stronger than xylazine. So you can see a pattern. Things are becoming more and more unsafe. And then the last substance drug that I just want to make you all aware of is something called carfentanil. Carfentanil is an opioid, but it is 100 times stronger than fentanyl. And so it really requires like just a tiny, 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 tiny amount to really cause a death, unfortunately. And so we've seen that this year in many deaths, around 20 deaths in Wayne County. And so this is all very concerning, and really just underlines the importance of making sure everyone is aware of what's happening with the drug supply right now, that it continues to become more and more dangerous. And just assume there could be things like fentanyl in whatever is getting used. So we have these well-weighed stations out around Wayne County, around 80 stations across Wayne County where people can get free Narcan, free test strips to test their drugs for fentanyl and for xylazine. And so we really want to bring these life-saving tools out to all of you. The other thing that I don't want to,
Scared,
sorry?
scared.
Yeah, so I don't want to duplicate what Dr. B said. She did such a good job with talking about vaccines. It is winter season. This is the season for coughs and colds and all these viruses to circulate. The three we worry about most is COVID, flu, and RSV. And I know Dr. B talked a lot about that, but I'm so happy to hear folks getting access to these vaccines. It's very important to get every year a COVID shot, a flu shot. And then for those that are 50 and over, 75 and older, and 50 and over if you have health problems like diabetes or high blood pressure, to get the RSV vaccine as well.
What is RSV?
What is that?
RSV is the short name for a very complicated sounding virus called respiratory syncytial virus, RSV. It's another respiratory virus.
That has something to do with your breathing?
Yes. And so just like COVID and flu, it has very similar symptoms. So some people get fevers, cough, cold, sneezing. But what we worry about is when that virus goes into the lungs, and then it can cause bronchitis, it can cause asthma attacks. Yeah. And it can cause pneumonias, just like COVID and flu. And so this is another virus. So basically COVID, there's a lot of germs out there during the winter season, right? And coughs and colds. The three that we worry about most, RSV, COVID, and flu, is because it's the one that makes people the most sick, right? So it's the one that, you may have a cough and cold and you hang out at home for a couple days, right? But the ones that really send people to the hospital in this time are these COVID, flu, and RSV. And that's what we're really trying to prevent with these vaccines, right? We know, we've all heard stories. I got the flu vaccine and then I got flu. Or I got COVID vaccine and then I had COVID, right? Because these vaccines aren't meant, go ahead.
When I first got the COVID vaccine, I did get COVID when they first started with the COVID in 2019.
Yeah.
I got COVID real bad. I was so sick and it wasn't funny.
Yeah, and it was pretty terrible right at the beginning, right?
Yeah.
And so what we're trying to do with these shots are not necessarily stopping you from getting it.
I hate
But
the
we're-
COVID shot.
That's great.
I got this recent one in September. And I got the flu shot too.
You're an A+. We need to put you on the poster and get you out in the community to tell your friends.
We both did it at the moment. Me and my buddy right here.
That's great. That's awesome. And, and I bet you telling your friend to get a shot has more impact than me telling that person to get a shot. So I appreciate you going out and taking care of yourself and taking care of the community around you. And so, yeah, we're just trying to keep people from the hospital from these things, right? And keep people off the ventilators and out of the ICUs. And that's what that vaccine does. It really takes something that could be serious and just turning it into, a couple days at home, sitting in bed, taking care of yourself. And so we hope that you talk to your provider and make sure you take all the steps to stay safe.
I go to the health department, check on my shots on a regular basis, see if I need anything.
That's great. And so they, at the health department on MAC, they can look you up in the system and tell you exactly what you need. So that's exactly where you should go. They're great over there.
At the COVID shot, last time we had that thing out in Victor Village, kind of clinic, had a COVID and a flu shot.
That's great.
I got a list on all my shots.
That's great. Yes, it's always good to see and talk to your healthcare provider to see what you're due for. We focused on all of our winter bugs, but there's a lot of other vaccines that you all need to stay protected, and really talking to your healthcare provider to see, what am I behind on? What am I due for? And asking the questions, like you were saying, like, oh, I'm afraid of this shot, right? Ask those questions. Ask the questions to your healthcare provider versus Dr. Google, which can lead you down a whole different rabbit hole that may not be really right information.
Speaking of vaccines, Dr. Posias and I had numerous conversations about the activities related to the Vaccine Champion Work Group and how it informed what we're doing down here in Southeast Michigan. Dr. Posios, could you talk about that for us? And raise the issue, I think, with Dr. Bagdasarian about the work that was done and what more you're feeling we need to do. We've had multiple conversations about this topic.
And I'm glad that we're all here together and we're getting input from person served, from people that are like, boots on the ground. First of all, I want to take my hat off to Dr. Reed, but to Candace and her team for really partnering strongly with OCHN, as well as Genoa Pharmacy, on identifying we already know the people we serve are at an elevated risk compared to the normal, the general population with respect to severe outcomes from COVID and other diseases. But we identified the kind of highest of the high risk group and really looked back, what vaccines have they actually gotten with respect to COVID, and if they haven't had a vaccine in more than a year, and they have X number of comorbidities, how can we make sure that we have a personalized, targeted conversation with them about getting vaccines? And CNS has been fantastic about proactively having those conversations, identifying those folks. So some of the other topics with respect to Vaccine Champions Clinic, our conference. I thought it was a fantastic conference. I'm really disappointed that it didn't happen this year. I was hoping that we could at least have done like a virtual conference, because those kind of conversations are needed now more than ever. Misinformation and disinformation is a huge challenge, but also making sure that persons served have the information at hand in order to make rational decisions about getting vaccinated is also something that falls on us. So I feel like we could be doing a lot more educating persons served about not just the acute consequences of COVID and why you want to get a vaccine, but what are the longer term sequelae from getting COVID and flu, right? Increased cardiovascular incidents, neurological issues, immunological issues as well, and making sure that people really understand that there is a longer term, game at hand, so to speak, with respect to making sure that you're protected. And so it makes it hard for us, I think, to have those kind of conversations when we don't have information at hand. MDHHS was providing information on testing positives, and then it shifted to percent ED visits, and even that I think has gone away. I could be mistaken about that.
They're updating it less frequently.
So we have less information to work with, and that means we can't combat the misinformation and disinformation and share these kinds of real world, data with the person served. And then also there's a responsibility that we have as physicians to, make sure that the people that we serve know that things like COVID and flu are serious or can be very serious. And, I think that we as physicians have to some extent normalized COVID. We kind of say it's not a cold, but, do we really walk the walk when we have these conversations with people? So I'll get off my soapbox. But I think that one of the things that the Vaccine Champions Conference really did was to encourage conversations like this and talk about ways in which we can more effectively, support the people we serve in making sure that they're protected, and talking about those, what works and what doesn't work, I don't want to say instilling fear, because that's, I guess, the wrong term, but making people, aware that, there are some things I should think about when I make a decision about getting a vaccine. So, but anyways, Dr. Reed, again, thank you to you and your team at CMS. They've been fantastic. We continue to partner on this. We've adopted the Vaccine Champions moniker to align with MDHHS's messaging, and it's been very effective, and one of the things that I'm really most proud of.
Well, and I think, Dr. Post, there's one issue you brought up, and we looked at some peripherals made by the Wayne County Health Department, really is how do we communicate with people differently? Like today, 5 years ago, when we wanted to have a meeting with people, who even knew about Zoom, who even knew about Teams, we were not really having a strategy around social media, and it would have involved us bringing 300 people together in a room to have activity. Fast forward, something we learned from the pandemic about how better to get information on the community. And I think that I'm looking at this flyer with regard to Narcan, and it almost has a feeling like a graphic novel. So how we communicate with people. And I think Dr. Bagdasarian, you brought up an issue about the state having a location we can go to when looking at what disinformation is out there. Tell us about that. That to Dr. Posios' point, there are some resources there for us when we're seeing trends of information in our community, and how we could work with our marketing professionals and outreach professionals to layer messages. So it's more about layering messages and meeting the community where they are, not necessarily bringing 300 people to a room, but being able to broadcast out and have the information available when they're ready to receive it.
Yeah, excellent question. I think that a lot of people are getting their health information from social media, especially when I talk to young people. Young people are getting a lot of their health information from TikTok. And so we've got to meet people where they are. We've got to give them good information on social media. So one of the initiatives we have is something called the Michigan Health Communications Initiative. And it is, we're working with a nonprofit group that does something called media monitoring. So they're looking to see what kind of news is trending on public health topics. So what are people talking about with vaccines or with overdoses or firearm injury? What are people talking about in these spaces? And they create a bulletin once a month that fills you in on all of this information and shows you how to address any misinformation that might be out there with unbranded social media content that any organization can then post, because your communities want to hear from their local organizations. They don't necessarily want to hear from the state of Michigan. So we can give you the QR code to that. But I do want to say that some of the common misinformation about vaccines is every time I get the flu vaccine or the COVID vaccine, it gives me the flu or it gives me COVID. Have you all been hearing that?
Yes.
Yeah. And the truth of the matter is, these are killed vaccines and they cannot give you the flu or COVID. If you're getting a shot, flu vaccine or COVID vaccine, they cannot give you those diseases. What they really do is they reduce the severity of these illnesses. So you might still get, as Dr. Sheth mentioned, you might still later on get COVID or get flu, but what it does is it prevents those severe complications. These vaccines reduce emergency department visits, urgent care visits, hospital admissions, and death. And that's what we want to prevent. We can't guarantee you a season where you're not going to get sick, but if you pick up these viruses, it will keep you from having some of these really severe complications. And also, some of the long-term complications that Dr. Posius mentioned, some of these, COVID, there's a lot of people out there with long COVID. And there's a lot of people out there with long-term risk factor or long-term effects of these illnesses. And vaccination is one of the best way to prevent those. The other thing I like to tell people is folks are always asking me, what's the best way I can boost my immune system this season? I want to boost my immune system. And a lot of people are taking supplements, they're taking zinc, they're trying to take a vitamin. The best way to actually boost your immune system are vaccines. That's what vaccines are. They're immune system boosters. What they're doing is they're giving your immune system an instruction booklet on what to be on the lookout for, and then your immune system is boosted and can fight against those things. So if you are looking to boost your immunity, vaccines are some of the most effective ways to do that, in addition with getting enough sleep and having a good diet and getting regular exercise. So those are just some of the pieces of misinformation that our social media initiative seeks to address.
Well, somebody brought this up, I heard it twice. How long does it take once you receive a vaccine for it to work? So you're not necessarily getting COVID from the vaccine, but the vaccines don't work immediately, correct?
They don't work immediately. So most of the time we tell people, it takes a couple of weeks after you get the vaccine. But of course, it's not like an on-off switch. The immunity starts to build up. And after about 2 weeks, you will probably see your greatest protection. And then those vaccines have good protection for about 4 months. So that's why we recommend getting your booster every year, is because that immunity, it ramps up and then it sort of declines after 4 months as well. So we want to keep you safe and protected over these winter months, because we know that these viruses like to transmit when it's cold and dry weather. They can survive on surfaces for longer. We know that when you are run down and when you're tired, as a lot of people are over the cold winter months, your immune system might be a little bit sluggish. And so we want to keep you as safe as possible over December, January, February, when we typically see those viruses go up.
Quick question. So the illness that you get, is it because your body is developed antibodies and is fighting it? So, and that's what the vaccine is doing, is giving you those antibodies so that now if that foreign substance comes around, you have the fighters in your body to fight the virus.
That is
I don't know how to say it as good. as
No,
you
no,
say
that
it.
is exactly right. So when people feel achy, when they feel run down after getting a virus, a lot of people say after I get my COVID vaccine, I want to take the weekend to rest
Right,
and relax
right.
because I'm not going to feel good that weekend. That is your body actually producing antibodies. That is your immune system kicking into high gear. So when you get the vaccine and you feel a little achy, a little run down for a couple of days, that is your immune system doing exactly what it's supposed to do. And that response, that's what's hopefully going to keep you out of the hospital if you get the virus later on down the road.
And we have one additional question, I think, before we wrap it up today. Dr. Allison Palmer, our medical director, has a question or a comment.
So thank you for the presentation. My last question, the QR codes like for social media, those would be very helpful. Reaching our older adult population, do you all have like printed material that you mail out, or what do you kind of recommend when it comes to that?
So, is there some specific information?
Just like the same that you would like put on social media, but to
Right.
really reach like that older adult population who
Right.
might not be there.
Yeah.
Do you all develop material for that we can kind of tap into as well?
So you're saying like, how do we target our message?
Yes.
For, like the graphic novel
Yes.
aspect of it, I think in terms of Narcan would reach a certain population, but we're having to have targeted campaigns based on our population. So any suggestions or ideas around reaching older adults, the group that you say is vaccinated most, right? I mean, earlier in the presentation, we
Yeah.
talked about them being the most at risk, but also the most highly vaccinated groups.
Yeah, I mean, there's certainly organizations and websites where there are some, materials that are tailored to different populations, and we can definitely share those. I also think, with our overdose work, we do have some printed materials too that we can share with you and your team. I also think that sometimes it's the conversation, right, that is even more impactful and compelling, especially for the older population.
Right.
And when we say that, trust is eroded, people still trust their providers and any provider. So it doesn't have to be a doctor, right? It's somebody that is it your caseworker, your recovery coach, your counselor, your therapist, all of these providers still, people look to them for advice, right? And there's nothing more powerful than that.
Thank you.
Thank you so much for everybody for being here, for us to have these crucial conversations in Southeast Michigan, Wayne, Oakland, and Macomb counties, focused on substance abuse and overdose, gun control, and vaccination. These are three areas that we are that most impact us and that we're most concerned about. And again, we welcome the opportunity to have these crucial conversations and to use this as a vehicle to amplify the conversations in the community with outreach around social media and targeted populations. So we really appreciate the Wayne County Health Department and the Michigan Department of Health and Human Services for joining us here today. Thank you so much. And we look forward to continuing the dialogue that we started with Michigan's Champions for Vaccines. We look forward to continuing that dialogue moving forward. Thank you so much for having us and coming to this.
Dr. I want to mention that resources on the table over here.
We have some resources on